Let's talk about skin cancer. What is cancer? Cancer is a term used for diseases where some cells reproduce and grow abnormally and have the ability to spread to other parts of the body. When cancer spreads, it is called metastasis. Cancer cells can spread to nearby body parts or through the blood and lymph systems to more distant parts. Cancers are named for the part of the body or the cell where they started, even when they spread to other parts of the body. What is skin cancer? Skin cancer is when some skin cells become cancerous. Skin cancer can affect anyone and can occur anywhere on the body. It is most common in areas that have been exposed to sunlight. How dangerous and common is skin cancer? Skin cancer is the most common type of cancer in the United States. It is estimated that 2 million people in the U.S. are diagnosed with some form of skin cancer each year. When detected and treated before it spreads, skin cancer is highly curable. What is ultraviolet light and why is it so dangerous? Ultraviolet light is the main source of light given off by the sun. It is also called ultraviolet rays, or radiation. There are two types of ultraviolet rays. UVA rays make it hard for your body to fight infections and cancer. UVA rays can also pass through windows and change the deeper layers of skin. This can cause spots on your skin, premature aging, and wrinkles. UVB rays are the main source of sunburns. Sunburns will increase your risk of developing skin cancer. All sources of artificial sunlight or ultraviolet light, including tanning and salons, should be avoided. Ultraviolet light is sometimes used for medical purposes, but should be done under the supervision of your healthcare provider. Are there different types of skin cancer? There are three main types of skin cancer, and they come from the three types of cells that are found in the top layer of the skin. Basal cell skin cancer is the most common type of skin cancer. It grows slowly and rarely spreads to other parts of the body. The most common site is the face. Squamous cell skin cancer usually occurs on parts of the skin that have been exposed to the sun, but it can occur in places that do not get sun exposure. Even though it grows slowly, if not treated in time, squamous cell carcinoma can spread. Melanoma occurs when the cells that produce the pigment that gives the skin its natural color become cancerous. Most melanomas develop from either a pre-existing mole that begins to change or a mole that newly appears. This can occur on any skin surface. While melanoma is the least common skin cancer, it is also the most serious. What are the risk factors for skin cancer? Risk factors that you can avoid or control. Unprotected exposure to natural sunlight. Exposure to ultraviolet rays from tanning beds, booths, or lights. Exposure of old scars and burns to ultraviolet rays. Exposure to arsenic. Having an infection with certain types of human papilloma viruses, HPVs. Having a precancerous skin condition called actinic keratosis. Smoking. Although many risk factors can be avoided, it is important to keep in mind that avoiding risk factors does not guarantee that you will not get cancer. Therefore, regular screening is recommended. Most people with a particular risk factor do not actually get the disease. Risk factors that you cannot avoid or control. Having a fair complexion. Having chronic skin inflammation and/or skin ulcers. Being treated with radiation for another illness. Having a weakened immune system. Age. Taking some medications or having certain genetic and medical conditions. Having a family history of skin cancer. Having many moles. What are some things I can do to stay healthy? By staying as healthy as possible, you help to lower your risk for developing cancer and many other chronic diseases. To stay healthy, you should eat healthy, stay active, limit alcohol, and do not smoke. How is skin cancer detected? A full-body skin examination is used to detect skin cancer. It is important to do this self-examination, preferably monthly, so that when a new growth appears or an existing one changes, you will notice it. If you notice anything new, different, or worrisome, talk to your healthcare provider immediately. Early detection is important because it increases your chances of survival, it allows you to have more treatment options and less invasive ones, and the treatment and its side effects may be less severe. Here are some tips on how to do a self-exam of your whole body. Using a full length and a handheld mirror to look at your skin. Start at the top of your head and work your way down. Make sure to look at all the surfaces and all the sides, even underneath and other areas that are not easily seen. Do not forget to look at your scalp by using a comb or your fingers to part your hair to see the skin underneath. Do not forget to look behind your ears. Make sure to look at your nails and in between your fingers and toes. Rarely, skin cancer can occur in your eyes or mouth, so make sure to look at these areas as well. How is skin cancer diagnosed? Skin cancer is diagnosed by a healthcare provider through an examination of the skin and a biopsy of the affected area. What is the treatment for skin cancer? Skin cancer is usually treated with surgery, radiation, chemotherapy, or a combination of treatments. The treatment for skin cancer depends on the type of cancer, the size and place on the body, your general health and medical history, and whether or not it has spread to the other parts of the body. Sometimes, all of the cancer is removed during the biopsy. If I have a dark complexion, can I get skin cancer? Even though it is less common in people with dark skin, everyone is at risk for developing skin cancer. If you have a dark complexion, you still need protection to help prevent skin cancer. How can I protect myself against skin cancer? The best way to try to prevent skin cancer is to protect yourself from the sun. Healthcare providers suggest that people of all ages limit their time in the sun and avoid other sources of UV radiation. For more information or referral, call the National Hispanic Family Health Helpline at 1-866-783-2645.